Identifying the initial indications of schizophrenia involves observing that individuals experience auditory and visual hallucinations and struggle to differentiate between real and imaginary objects. Schizophrenia is a severe mental disorder that impacts thought processes and emotional regulation. Although those with the illness may experience delusions and hallucinations, they are generally not a danger to others, and there is hope for recovery with appropriate treatment. Consistent psychotherapy can aid individuals with schizophrenia in leading a meaningful life and even finding enjoyment. Identifying the initial indications of schizophrenia is important, and it is worth noting that the disease is actually quite common, affecting 6 out of every 1,000 individuals. The symptoms of schizophrenia typically progress gradually, with family members initially observing somewhat unusual behavior in patients. A common pattern is when high-achieving students suddenly drop out of school, neglect their appearance, lose interest in their hobbies, and become socially withdrawn. It is essential to pay attention to specific indicators in such cases. Social isolation. The patient becomes a recluse, loses interest in socializing, hobbies, and work or school. Ambivalent emotions. The patient experiences conflicting feelings such as love and hate, joy and sadness, or fear and excitement. Unusual way of speaking. Difficulty maintaining a topic and avoiding answering questions. Difficulty with concentration on everyday tasks. The patient may neglect personal hygiene and become unkempt. Increased anxious thoughts, exhibiting obsessive-compulsive behavior, apathy, or depression. The symptoms outlined earlier become more pronounced and frequent over time, often leading to a later diagnosis when the illness has progressed into a more typical form of schizophrenia. Characteristic signs of schizophrenia. Most patients with schizophrenia experience simple delusions, which make up about 90% of cases. Examples of such delusions include: my neighbor is trying to poison me with radioactive waves. Martians are planning to abduct me for scientific research. I am Napoleon, and I have a special mission in this world. I see signs and hear the voices of angels who are trying to communicate something to me. Common delusions among schizophrenics involve the notion of being persecuted or controlled, grandiose beliefs, and special abilities such as levitation, telepathy, and communication with spirits. Hallucinations are a common symptom of schizophrenia and can take various forms, including visual and tactile. Although auditory hallucinations are the most prevalent, patients may see terrifying creatures, bugs, or images of their own decaying flesh. They may hear voices that haunt them, give them bizarre commands, or insult and belittle them. Interestingly, the more a schizophrenic isolates themselves from society, the more intense their hallucinations become. Schizophrenia can cause eccentric behavior, leading to a change in a person's usual characteristics. For example, a once excellent student may start failing in school. A formerly reserved person may become overly emotional and prone to hysteria. An individual with a strong obsession for cleanliness may neglect their hygiene, and an extroverted person may become a recluse. The schizophrenics may struggle to manage their impulses, take care of themselves, and perform daily tasks. They often break ties with the world and become socially isolated. Fragmented thinking is a common symptom of schizophrenia, which affects a person's ability to communicate coherently. The speech of a schizophrenic patient may be incoherent and lack meaning. They may struggle to maintain a simple conversation, providing illogical answers and inventing words that do not exist. They may also become confused and repeat phrases multiple times. Negative symptoms are a common feature of schizophrenia that can result in a decrease in sexual desire and the intensity of emotional reactions. Individuals with schizophrenia may become apathetic, finding it difficult to experience the joy of life and engage in their usual activities. Their voice may become dull and monotonous, and their eyes may appear indifferent. They may avoid direct contact with others and spend hours staring at a single point. Basic self-care activities like eating, washing, and combing their hair may become challenging due to a loss of motivation. Schizophrenia can have various causes, in some cases 10%. It may be influenced by a hereditary factor, with a history of the illness in the person's family, such as their mother, father, brother, or grandmother. Difficult childbirth, 30%, may also contribute to schizophrenia, particularly if the mother drank or took drugs during pregnancy, suffered from viral infections, experienced physical abuse, or if the child sustained a birth injury due to hypoxia, all of which can increase the risk of frontal cortex damage, which controls planning, decision-making, and logic. However, in 60% of cases, schizophrenia is triggered by stress factors such as early parental loss, physical, emotional, and sexual abuse during childhood, neglect, unemployment, poverty, alcoholism, and traumatic experiences that the person could not handle. Types of schizophrenia. The paranoid form of schizophrenia typically appears later in life, usually after the age of 18, and is often triggered by severe stressors such as the death of a loved one, job loss, or a difficult academic workload. The individual experiences auditory hallucinations and delusions such as persecution or a sense of having a special mission, but they are able to maintain relationships, work, and take care of themselves. Their symptoms can be difficult to detect by loved ones as the person may become overly suspicious and cautious while hiding their symptoms. The hypophrenic form, also known as classic schizophrenia, is characterized by emotional instability in the patient. Their emotions swing wildly, their expressions of feelings are inappropriate, and they behave in a silly manner. They also have disorganized and incomprehensible speech, like nonsensical gestures, and have difficulty with self-care tasks like cooking and paying bills. As a result, they rely heavily on the assistance of their family members. The catatonic form of schizophrenia involves additional symptoms on top of the ones mentioned earlier, including stupor, purposeless physical movement, the patient's unwillingness to follow instructions, sometimes even resistance to them, unusual and awkward body positions, slow speech, and repetition of the same phrase repeatedly. If you or your loved one show signs of schizophrenia, it is important to seek immediate evaluation by a psychiatrist. Similar symptoms can also be seen in other medical conditions such as brain tumor, epilepsy, encephalitis, bipolar or schizoaffective disorders. It may take a few months of observation to confirm the diagnosis, but starting treatment early can improve the chances of leading a normal life. Watch more interesting videos about psychology and how to solve various complex issues on our channel. Subscribe, like, and comment on this video.